Hi, I am here to actually tell you something about Down syndrome. About it, it is important to know that there is actually no single standard treatment to it. Usually, the care provided is based on the individual's physical and intellectual needs. And most of the time, they also consider the physical strengths. I mean, not only physical, but the whatever strength or limitations the patient has. What is also good about it, at least, is that the treatment given can be rendered at home or in the community in which the patient lives in. Uh, the treatment, okay, provided is not given by a single healthcare professional. That's just one of the downside of it, because probably of the financial needs of it. Usually, the patient needs a team of multidisciplinary healthcare professionals who will who will provide care which will address the holistic needs of the patient. Usually, we need the physician, the direct physician. We also need therapists, such as speech therapists, occupational therapists, and physical therapists, and also social worker. But again, these are not limited to these professionals. It is based on the individual needs of the patients. Okay. Also, it is very important to remember that in providing the care, that the professional, for example, me as a nurse, I should be able to give not only not only the standard medicines, for example. I should be able to give enough stimulation, okay, and encouragement to the child and to the people around him, because it's a very challenging condition. Another downside of it is that the child who is born with Down syndrome is actually more prone or at an increased risk of having other health-related conditions than those who do not have it. Usually, these conditions requires immediate treatment, or if not occasional, lifelong. To cite an example, some infants are born with heart defects secondary to Down syndrome, and in order to save the life of the infant, they need surgery. The infant needs immediate surgery, and also these patients usually need occasional support or treatment throughout their childhood, throughout their adolescence and adulthood. Again, depending on the type of condition they acquire secondary to Down syndrome. Another example, just to elaborate it, for the lifelong support, for example, those who are born with digestive problems who cannot be cured or which cannot be addressed by any type of surgery, for instance, they will need a special kind of diet throughout their lifetime. So it is very important to remember that these patients needs or is at least totally, if not totally, is at least really dependent on the people around them. Okay. And just to give some advice for those who take care of children or even adults with Down syndrome, it's very important to give your understanding and patience. And other than money, other than the whatever sources that you give, the most important thing that you can give to them is your love and devotion. Okay? Because nothing beats that. This is the only thing that can help you, for example, the mother, the father, or the relative. This will help you to be able to adapt to the challenge and accept the challenge of having to take care of a child with such condition. Okay, it's love. So that's it. Thank you.